Thanks for staying with us. So, COVID-19. The governor told us a couple of days ago that the isolation centers have increased from 1% to 6% in Lagos. That's quite scary. And we just read in the news this morning that Ibadan, Oyo State, actually recorded 2 deaths. They have 1 person who is in critical condition, and they've contact traced to find others who this person has been in contact with. That's for the Delta variant that everybody's talking about. Now, for those of us who watch international news, we understand the Delta variant, how potent it is in the fatalities recorded globally. I think it's also one of the variants in India, I believe. I think UK also recorded this variant. So we are concerned about this variant. I know the federal government also cautioned us, especially they tried to stop flights from South Africa, I believe, and I think from Brazil. Although they didn't stop from UK. I know US stopped flights from UK, but we didn't. But we are going to have I'm going to hear your thoughts on it, because we are all party lovers. Yeah, this is me. Let me speak for myself. Yeah, I love to go to parties. I love to dress up. And I was really happy that I've been vaccinated. Yeah, it doesn't mean that I'm throwing caution to the wind, but I go with my face mask. When it's time to party, we know we do everything. So we need to understand, where are we going on this matter? Is this thing back here? Are we going back to isolation? What exactly is happening? We'll be having Japhet, who's going to give us information in a minute. But let me hear your thoughts, ladies. When you got this news on this variant,
I was like, again. Yes. How did we open our eyes and then we let this happen to us? So, you see, the child...
all of us open our eyes.
But no, it's not our responsibility to protect from people coming in. It's the government responsibility to protect our borders. If you're applying for UK visa, you must indicate where you're going to do your isolation, because it is compulsory that if you're coming into a country, you must isolate yourself. So now let's assume that it is Nigerian citizens that brought this Delta variant in. We must be our brother's keepers at the same time. Many people had voters apathy in Nigeria, and we don't even have enough vaccines. We're not vaccinated to the capacity that would even protect us. So there are on many levels, we are not handling this thing well. And I cannot fault Lagos State, because Lagos has really, really tried. Like, what else would you expect the governor to do? They've announced, they've made it known. So at this point, I don't want another lockdown. I don't want another modified lockdown. I don't know how the policies can be put in place to help us curb the spread without putting businesses at risk, without putting people livelihood at risk as well. So we must now make a decision that we will not let our case become India, because this is the same variant that caused a lot of death in India. We don't want that to happen in Nigeria.
Let me hear your thoughts on this. And that's what's important. You know, lockdown and all that, businesses shutting down, they're very important, but also what is even just as important or even more important is deaths. We don't want deaths. And if there's anything we need to know about this variant quickly, and so that we can start to incorporate it in our lifestyle, we need to know about it soon. I heard that some of the symptoms are headaches, sore throat, and runny nose, and that you may or may not have that loss of smell and taste. You know, that was with the other one. That was one thing you could say, okay, maybe I have it, and then you take yourself out of public. But now we have people just going everywhere. We're back in work. Our children are back in school, and that's what scares me the most. That our children are. I know that it says somehow that maybe children have like a better or greater immunity, but we've heard in some cases where some children have been affected and have died. So we need to put into place, you know, things that that will protect us from spreading this further and endangering our lives.
Nima.
Well, you know, we had to respond to this first one that we were dealing with. We had to quickly create isolation centers before hospitals, and we couldn't see the demand for oxygen and all of those things. So I pray, may we not see what happened in India ever in our lives.
But what is most painful, Nima, because is the irresponsibility on our parts. The government. We are going there. Thank you.
I'm going there because I noticed that a week ago, in fact, for the past month, kids below 10 had a particular same symptom across board.
Yes.
The mother and child hospital that I would take my children, I got there, the car park was full to the brim, and I peeped in. As I just saw the children waiting in the car, I saw a large crowd of people in the waiting area for pediatric care. I took my kids to a private hospital immediately. So we know sometimes we see these things that we suspect, but then I will get back home, we just go and party. Or go out, sorry. We just go, we just go and go back to our regular lives as if nothing. And then we have Nigerians for no business economic reason booking flights and traveling and acting like everywhere is fine. When we have Brazil, we have India,
UK, sir.
We have South Africa. We see these things. We go to those countries and we come back as if nothing, and then we come and blame government.
Yes.
If it is not extremely important, sit down for your house. It is not going to cost you anything. Yeah. For the few number of years that you
more annoying, Nima, is that when you now come back, you don't isolate.
No,
the Commissioner for Health kept saying that they are tracing, 1,000 people who came into the country. So is the irresponsibility of these same Nigerians who are supposed to be exposed? You travel abroad, you think that you're smarter, you're more informed, you come back and you isolate yourself. No! They go right back into the
people that want to even come and see you too will be saying, why is not serious? I went to nothing like that for you. You know?
We are fine.
I know 2 people who went to China at the height of the other one. And they came back and said, I beg, don't tell me that. And they didn't fall sick. Yeah. But and they didn't act responsible as well. We need to be able to say, this is what I did. And then you can leave government to it. With all the care that I had COVID. And some people said, no, I was paid to say that I had COVID.
Imagine.
Oh, yes.
Yeah, the messages are still on my DM. People attacked and said, Nima is saying she has COVID. She was paid for it. I wonder how much somebody will pay me for such a thing.
That.
I don't understand. So we need to act responsible. I was the only one who had a bucket to wash my hands in my house. And I was the only one who had COVID. And I was the last one to take my bucket inside. The people that didn't have it still think that there's no such thing. So we need to do more. We need to have government officials now that they are announcing
but they did not show symptoms.
Most people had. Most people it was malaria.
We need to understand the state of things in the medical centers. Let's go on the break. When we come back, we'll speak to Japheth. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So I'm going to be getting Dr. Japheth on the phone. Okay, I'm told he's not yet online. We're really trying to get him on because we need to know what's going on. Not just in Lagos State, what exactly is being discussed from the federal government level, because we know that this variant is very deadly, and we want to know how far can we go. Do we stop parties? Because that's my own number one concern, I'm sorry. But schools, I'm happy that the schools are still safe. The schools have maintained, and I'm so grateful, they've maintained that level of protection for the children. They still have their face masks. My own school,
they protect the children from the teachers. Children interact, but I know that I've felt a bit that my children are not feeling the best of teachers because teachers have to maintain distance. Till now, they still maintain that distance.
But also talk to your children and find out exactly how it is carried out in the school, because the children will tell you, Bobby, when they're in school, they throw their mask away, they are playing with each other. It's not exactly as strict as you think it is. And we understand. It's not exactly even for us, we come to work, we're all masked up. But after a while, you're interacting. Yeah, so that's the thing. You have the sanitizer at the door to go in, to come out, they check you. But when you stay in a enclosed environment for 5 hours or more, it's just normal. And I've seen the children play with each other. Some of the teachers running, be careful, but there's sweat everywhere, so it's not possible for
I have Dr. Japheth on the phone. Good morning, Dr. Japheth.
Good morning.
Good to have you on. So,
yes, it's my pleasure to be with you.
This Delta variant, Dr. Japheth, what is happening now? I thought you guys got us covered. I thought you got the people covered, which that will feel good that there's no issue in Lagos State. What's happening?
Thank you very much for having me once again. Yes, we thought we got you covered too, but it was just a matter of time because we want the global here and there, all over the world. So it was a matter of time before we had the Delta variant. So wouldn't say it was.
I can't hear you clearly, sir. It's a bit blurry.
I wouldn't say it was totally to us as health workers. I think it was just Covid-19. And then it's maybe unconnected to the fact that we don't have enough vaccines in our country. Delta variant is going on in so many countries of the world now, over 19 countries of the world where they have the Delta variant. In fact, a handful of other countries have the Delta plus variant. So you cannot close the border for economic reasons. So people move up and down. When people move in and out, then they bring in the Delta variant. So I think what we should be looking at is to procure vaccines for our population.
It's not very clear. We can't really hear you properly. I don't know if the people at home can hear you. Nima, you had a question?
I can hear you clearly.
Yeah.
So Dr. Japheth, can you remind us what were the measures in place to make sure that those coming from these high-risk countries are isolated? Because it seems like government too relaxed on this issue. We'll be reading over for weeks about Brazil. We've been reading for months about South Africa and the UK. We saw what they did. So what exactly was the measure that you put in place to reduce or at least prevent this happening at all that we have now?
Thank you very much. That is a very good question. It all depends down on the measures of the government. Now, let's start from this perspective. The government recommended that people who want to come into Nigeria have a test done from wherever they're coming in. Now, when they get to Nigeria, they will also be put or be placed on self-quarantine for 7 days, after which they will do a test in Nigeria to confirm whether they are positive or negative, so that government can isolate them appropriately. Also, their details are meant to be dropped at the point of entry so that health workers who are in charge of that can monitor them, can follow them up, can call them up to be sure they're not showing symptoms, to be sure that they are fine, or to be sure that they're actually obeying the self-quarantine rules. But what we have found out is that people were not obeying all these protocols. People were not carrying out the test when they get to Nigeria. People were not staying in self-quarantine for 7 days when they get into Nigeria. People were giving false addresses, false telephone contact when they get into Nigeria. So all these are some of the things that made us get to the point where we are now. Because the Delta variant was not manufactured in Nigeria. It was actually brought in, most likely, in my opinion, it was brought into the country. And it must have been brought in by people we call passengers of interest, POI, who arrive from destinations where this Delta variant is rampaging and endemic there.
Right.
So I think that is the exact problem we have in our country, enforcement.
Right.
Dr. Japheth, there are a few things we just would like for you to help us clarify, some myths. You know, many of us have gotten our vaccines, we're fully vaccinated, but we're hearing that, no, this particular one that you have, this specific one for Nigeria, it does not work against this Delta variant. That's one. Secondly, they say that the efficacy drops after a while. So even though you've taken it, after a while, you find yourself even more susceptible to this variant, like someone who's never had the vaccine before. I think there's one more, but those are the two I remember, yes.
Well, first of all, the vaccine is actually safe and it is potent against the Delta variant or even the previous variant. So people who have had their shots are protected against the Delta variant. Now, the caveat is that people who have had their 2 shots may have the virus, but they will not develop the disease. They will not have a bad disease from the virus. So all this information, all those stories are unfounded. There is no medical research to support them. But we know now so many of us have not been vaccinated in our country. Just about less than 2% of our population has been vaccinated. Far less have received the second jab. So we need to take precaution. So it's unfounded that the Delta variant virulent against the vaccines. The vaccines that are taken in Nigeria is one of the vaccines that is taken in the UK and even in the US. It's one of the 4 vaccines that have been taken in the UK and the US. And it is a good vaccine. It protects against the Delta variant. But people who are taking the 2 doses can still have the infection from the Delta variant, but it may not just make them fall so terribly ill,
Right.
unlike people who have not taken the vaccine.
Okay.
So we have two questions on Facebook. Festus Akiboyewa is saying fully vaccinated people were among the deaths recorded in the UK. And the UK has largely completed vaccinations and is advising us to be careful, saying that the UK says they should expect 200 deaths daily. Then Andrews in StarTimes says that the Delta variant goes for young people below 20. Is this correct?
Well, there is a data that shows that 99.9% of those who have died from COVID-19 are those who have not received either one dose or two shots of any vaccine at all. So that speaks volume to the fact that the vaccine actually reduces the mobility and reduces mortality. Is sickness from everything, mortality is death. So the vaccine reduces the number of people that die from the virus, the number of people that are being hospitalized from the virus. Yes, the Delta variant, we are not sure if they are more virulent in less than 20 or above 20. But no, we are sure that the Delta variant is more virulent than the previous variant.
Thank you, Dr. Jaffe. We have to wrap up with you now, but I think we'll be talking to you pretty often now that we have this condition, and we're going to keep getting updates from you. Thank you very much for joining us on the show. We're going to go on a break. When we come back, we move on to other topics. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.